When you say stroke, as you can see from the image, first rule is very important. F stands for partial dropping. So you will see one side of the face is usually dropped, which is very common. By the way, stroke is usually characterized by like one side paralysis because remember the innervation, especially with like motor movement, is contralateral innervation. Like this part of the brain, like the left side of the brain will convert movement on the other side of the brain. So that means if a patient is having paralysis on this side, most likely the affected part of the brain is normally on this side because of contralateral innervation. So you will see partial dropping, that is first early symptom. Then after that, you will see weakness of arms. Then thirdly is S, which is slurred speech. Now, if you notice all those three symptoms, now you have to time to call to the emergency, maybe to the hospital, maybe to ambulance, so that you normally take the patient to the hospital. So those are the most common early identification of a patient with a stroke. You can see how the muscle is actually very weak, so that they cannot even handle any objectives. This is just because of the damage. Right? So as the result of the deficit, the patient will end up having a damage. So what is the objectives of this session? So at the end of this session, you are expected to define or differentiate different types of stroke. You need to identify the possible risk factors, and you need to explain the pathophysiology of this condition. And of course, you need to know the clinical presentation, and you need to actually outline the various treatment modalities of different types of stroke. That is the expectation at the end of this session. Okay, then what is a stroke? A stroke is an abrupt onset of focal neurological deficit that can last at least 24 hours. So this neurological deficit should last at least for 24 hours, and it can be either ischemic or hemorrhagic. But however, in between there is a transient ischemic attack. So if a patient is having a focal ischemic neurological deficit less than 24 hours, and usually like about 5 to 15 minutes, or generally less than 30 minutes. So we call it transient ischemic attack. But most of the time, there is no deficit remain after the attack. So after the few ischemia, in most of the transient ischemic attack, there is no deficit of neurological attack. But in case of stroke, mostly there is actually a deficit, like permanent or temporary neurological deficit is really very, very common. So what is the global epidemiology of this condition? It is the second leading cause of death globally. You can actually even see it is the leading cause of disability in adults. Yeah, and about 90% of survival have residual deficits. This is the major problem. As City even said, the patient cannot work like after the incident. So remember, stroke incidence increases with age. So as we age, the risk of stroke will be very high. So this is something you need to know. So as we age, the incidence of a stroke will be very high. So mostly it is very high after 50 years, 55 years. So if you see normally, like the information CT shared, the patient is actually around 60. So this is still a risk factor. Then maybe let me ask you a question again. Can you outline few risk factors for stroke? Jennifer will tell us. Jennifer,
Yeah.
can you tell us few risk factor for a stroke?
Age,
Age.
old, yeah.
Okay, age, huh? Any other?
Cardiovascular diseases history,
Such as?
such as heart failure, heart infections, some or
Okay,
arrhythmiasis.
do you know heart infection is very rare? Heart infection is actually very rare. Okay, good. But I accept normally heart failure, age can be a possible risk factor. Any other person? Jedida will tell us maybe another two. Jedida, will you tell us or you are not there even? Okay, so we're assuming she's not there.
Sir,
Okay.
I'm here.
Sorry, maybe your connection is, sometimes to unmute will take some time. Huh?
Yes, I had a problem with my connection.
Oh, okay, no problem. Huh? Okay, good. Just tell us. Huh?
Can you say high LDL cholesterol levels?
Yes, hypercholesterolemia can increase the risk. Okay, good. Yes. Any other?
Smoking?
Smoking, yes. Why smoking is a risk factor? Why smoking is a risk factor?
Because you can develop you can develop high blood pressure or something which can cause ischemic stroke. I'm not sure.
Okay, good. Yeah, that is one possibility. But most importantly, the chemical component of the cigarette, the nicotine, can cause endothelial damage. Yeah. So that endothelial damage is really a good opportunity for the growth of sorry, when there is endothelial damage means there is exposure of the subendothelial layers. So that exposure can actually increase the chances of platelet aggregation and adhesion and ultimately causes blockage. Okay, good. Now, so what are, generally speaking, what are the possible modifiable and non-modifiable risk factor for stroke? The non-modifiable ones are the age, gender, maybe it is common in African race, genetic predisposition. Yeah, those are the non-modifiable. So it is very common in males because of hormonal differences. Yeah, estrogen is very protective from ischemic stroke before menopause. Then the well-documented modifiable risk factors are the hypertension. Hypertension is in fact one of the most common causes of stroke. Atrial fibrillation, yes, specifically hemorrhagic stroke. But then if you see hypertensive with stroke, you expect hemorrhagic stroke because the high blood pressure normally causes rupture of the blood vessels, causes what? Stroke. If you recall very well, I mentioned somewhere, if the blood is actually leaked outside the blood vessels, and it can cause chemical irritation in the nearby areas in case of hemorrhagic stroke. So it can cause direct damage because of the chemical irritation. And apart from that, this hemorrhage can actually form a clot and deprive oxygen and nutrients to other part of the brain in case of hemorrhagic stroke. That is why sometimes you need to actually surgically, we call it like thrombectomy, can be done to remove the clots, even in case of hemorrhage. Then the cardiac disease, what I said before, like the rheumatic heart disease, which causes stenosis of the valves. Then maybe structural abnormalities in the heart chamber. Of course, even acute myocardial infarction, they can actually increase the risk of stroke. Even have you heard about even the association between COVID-19 and stroke? Huh? I don't know whether you have heard about this news. Huh? There is actually a lot of evidence, especially in like the most common cause of this in younger population associated with COVID-19 is because it can cause clotting and is because of stroke. Huh? Is there anyone who came across this article? Maybe you just read the association between stroke and COVID-19. Yeah, maybe you go to maybe Medscape and you see it from the news part. Okay, then the well-documented modifiable risk factors are transient ischemic attack. If a patient is having high history of transient ischemic attack, diabetes, those are independent risk factor. Dyslipidemia and oral contraceptives. Maybe can someone tell me why oral contraceptive increase the risk of stroke? Who will supposed to talk? Maybe Riga, are you there? Riaga, I think Riaga. How do you read?
It's Riaga.
Riaga, yes, okay. So maybe do you have the information why oral contraceptive, especially with the high concentration of estrogen component, decrease the risk?
Maybe I'm not sure, but maybe they increase the blood pressure. I'm not sure.
Okay. Okay. Any other person? This is one reason I mentioned.
They increase the contraceptives with estrogen. They will increase the amount of circulating estrogen, which will increase the concentration of clotting factors, increasing the risk of clot formation.
Yes. I can normally. Thank you so much. I can easily normally identify who was attending the class even. Yeah. When I ask few questions, I may maybe Tiffany the front line. Yeah, in terms of answering question, but other also follow. Yes. Thank you so much. So the estrogen component will increase the concentration of clotting factor in the liver, and this ultimately increases. And we have mentioned like a week ago about these issues when we were discussing about venous thromboembolism. Then similarly, the post-menopausal hormone therapy is the same reason. Who is presenting about sickle cell disease? The group members. Maybe can one group member tell us why sickle cell disease increases? Can one group member will tell us why sickle cell disease increase the risk? Who are the group members?
It's my group, sir.
So maybe, did you start preparing, Vivian?
Yeah, we are almost done.
So did you see something the relationship between sickle cell disease and maybe stroke or clot formation?
Okay, maybe because the sickle cells, they're not able to pass well in the blood vessels, so they clamp up and block the blood vessels.
So why they clamp up?
Because of their shape.
Because of their shape, huh? Okay, good. Yeah, because they are C-shaped. Remember the normal shape of RBC is disc shape. It's just like this. Maybe I don't know how you draw a disc. I'm not very good in drawing. So this shape, this abnormality in the change in the shape of the RBCs will actually allows the blood cells to stick together, which is an important which is an important situation for the platelet to adhere and aggregate. So we call it even vascular occlusion. So they can cause occlusion of the blood vessels, and they because of this behavior. Okay, fine. So for the detail, we're going to hear from the group member in week 12. Then lifestyle factors like cigarette smoking, the excessive use of alcohol, physical inactivity, obesity, and diet. Those are some of the possible risk factor for stroke. So finally, like maybe for today, I'm about to end from here. So then we'll see about the stroke classification. So stroke is generally classified into two broad categories. So the ischemic stroke, which is caused by a blockage of the thrombus or embolus, which accounts like 87% of the stroke present in the clinical setting. Then around 13% of the stroke is hemorrhagic stroke. By the hemorrhagic stroke, the prevalence is really it's not very common, but it is very severe. So as even the example City said, it is actually very dangerous type of stroke. Okay, then ischemic strokes are actually divided into different categories. Some of them are actually due to atherosclerosis. Some of them are actually due to like the blockage of the deep arteries in the brain. Some of them are actually due to the cardiogenic emboli, which accounts like 20%. But around 30% of the ischemic stroke is really not known. We call it cryptogenic. So this stroke is really not really known. So no one really knows the major causes. That is why mostly we know some of the possible cause of stroke. Around 30% of the ischemic stroke is really due to unknown causes, and 5% are actually due to other causes like a migraine, vasospasm, drug of abuse, prothrombic state, and etc. So this is the classification of the stroke. I think for the other class, I just stopped here. Maybe we can finish. We can finish on Thursday. Then one advice for you, can you read, because we are approaching like toward the end of the semester, and we do have like many topics to cover, including the presentation. So can you kindly read in advance? For example, if you do have class on Thursday, maybe you can go through look at the course outline, because I'm just following the sequence of the topics on the course outline. Then read in advance, please. That is really very important, and we can have very brief and important discussion every